The topic that I would be discussing here today is preparing to meet trauma, therapist preparation to meet trauma of self and others. The widely accepted goals of trauma therapy are helping the client get rid of the automatic response that has been built due to the trauma. It is also necessary to create a system by which the reliving of the traumatic effect is slowly minimized. The patient having the capacity to speak about the event without dealing with reoccurring emotions and images. After the treatment is complete, the patient should have gained awareness of the response, reversed it, and adapted to behave in a manner that is not the consequence of the trauma. Adding to the above, Anthroposophy in its unique ways would also emphasize on the aspects of closure. This is brought in by the therapist's grasp about the space that the trauma experience holds in either unfolding from the past, illuminating from the present, or shaping towards the future the unique destiny of the client. This meaningfulness, if grasped by the therapist, can be a valuable roadmap for intervention. This is being discussed at length in my research on transgenerational trauma, the abstract of which was presented in the earlier section of the conference. What does research say about the efficacy of therapists in general? When I chose this topic, two experiences stayed at the top in my consciousness. One was an experience in a training for psychologists, which I was facilitating. The class consisted of more than 20 counselors, out of which some were trauma counselors. During one group work that was controlled very well to provide the understanding of various therapeutic nuances, four persons out of which three were trauma counselors refused to go through the discussion, even when they had never experienced the mentioned trauma events ever in their own lives. This need to insulate oneself and finding oneself so brittle so as to refuse a simulation for learning better professionalism was quite unbecoming of a newer therapist. Another experience was of a therapist seeking supervision who constantly found every client's value-based struggles shaking the ground of her own value systems, especially in case of love relationships and in case of money. But even in the face of these constant challenges, it was intriguing that she did not wish to consider any other career option in the field of psychology other than being a therapist. She kept struggling and kept saying that she will do better, even when the countertransference that I relentlessly brought to her notice was creating trauma for herself. At one point, a valuable question that stayed with me was this: who amongst them was the real client? Newman and Gamble, 1995, in their article on issues in the professional development of psychotherapists, talk about 4 ways in which countertransference can affect both self-worth and efficacy of new therapists. They note as to how the incorporation of the therapist's sense of self and humanity into the role of the therapist is pivotal to the health of both the client and the therapist and for the healing process in itself. This makes a trauma therapist's need for collegial and institutional support very important and intense. Psychotherapy yields itself largely to trauma work in about any therapy session. Vicarious trauma, which is a secondary experience of trauma by the therapist while witnessing the narration, can be caused due to lack of right kind of separation. For example, the way it is researched in postural mirroring, where the therapist tastes the actual experience of the client, but can consciously return back to her own chair at will. In anthroposophy, I see this as the conscious experience of one's sentient body and the ability to watch the transformation of the same into the sentient soul activity. It is very essential for a therapist to be in complete touch with one's own sympathies and antipathies so as to achieve a certain equilibrium through which she can meet the eye of the client and perceive it as a complete whole. It is the higher sense of ego that can help perceive the client as he or she is, a perception non polluted by the therapist's own sentient world. Now, let us look at certain challenges widely researched in front of trauma therapists globally. I'd like to share a screen here to show you. Vicarious trauma. Trauma experienced by the therapist while into the process of therapy by walking alongside a client through the narration of the traumatic experience. Sometimes vicarious trauma has proved to obstruct the therapist's own sense of balance and objectivity, especially if there are even dismal parallels between the experiences of the client and that of the therapist. The second widely researched phenomenon is the occurrence of somatic countertransference. This is the experiencing of ill effects of narrated traumatic events, both through the lack of controlled postural mirroring, as well as what is largely known as compassion fatigue. Postural mirroring is used, if used well and with enough conscious control, is an excellent tool for trauma work. Other hindrances are the stressors to therapists that show difficulties inherent in the therapist's role. For example, loneliness and isolation, the daunting responsibility of being the dependable one, social distancing due to constraints of confidentiality, and the difficulty of explaining our own work to others. The last part, which I found widely researched as far as these challenges go, was the lack of guidelines or trainings for therapists to upgrade themselves with dynamic and contemporary understanding of socio-economic, politico-cultural angles of trauma, the perception of trauma, experience of trauma, and also the healing of trauma. Interestingly, in addition to these challenges, which are existent worldwide, India in its own way faces some unique set of challenges, and let us have a look at them. Mental health work in India is largely located in the tier 1 cities, becoming quite dismal in the tier 2 cities. This means that most people in India do not have an access to sound, well-trained professionals of psychology. While we say that, we also have to remember that most of the theories, therapy styles used in India originate from the Western countries, and they do not necessarily sit well with the philosophies, styles of living, and cultures widespread amongst the Indian people. As a result, therapy is sought by and provided to people who are exposed to the English language and to higher education, which largely has a Western influence. Though there are a few professionals who have adapted to bridge the gap between these therapies and the inherent ancient Indian wisdom. For example, certain works done by Dr. Anand Nadkarni. Such an endeavor doubtlessly needs superficial intellectual, I'm sorry, such an endeavor needs superior intellectual capacity. It is needless to stress that professionals with such capacities are very few, and therefore, most professionals would need concrete guidelines, concrete guidelines and trainings that pave a well established highway, leaving comparatively lesser and palatable scope for creativity of their own. In an interesting research, Pillai et al. 2015 brought the perspective that trauma work gained identity and momentum after the World War II, and the diagnostic category of PTSD was introduced in the US post the Vietnam War. Therefore, all trauma work is designed from the lens of the aftermath of World War II and the Vietnam War that lasted for about 3 decades. In India, however, the symptoms of PTSD are found in narrations as old as the Ramayana. This is obviously true of various other cultures and civilizations that do not need the validity of DSM-5 to understand a cluster of symptoms and call them trauma. Moreover, as discussed earlier, trauma work being developed in the Western countries post World War II is suited to the inherent philosophy of life of the Western world and have been found to have limited cross-cultural validity. In their study exploring the Indian perspectives in PTSD again, Pillai et al. 2015, stress on a few observations that mark the difference between Indian and Western culture and philosophy adopting a completely diverse perception of trauma. According to them, Indians have high resilience for such incidents because of prior poverty and hardships, and also because of familiarity to natural or man made disasters, while their Western counterpart are much lower in this kind of resilience. In the Western culture, locus of control is much more internal as compared to Indians. And there is a higher attribution of responsibility to one's own actions. The guilt resulting from this is much higher than their Indian counterparts, whose locus of control, as discussed earlier, is comparatively external. They also drive in the point that India is a collectivist society, because of which providing readily available emotional support to individuals is commonly seen. Whereas the individualistic society of the Western world makes it rather difficult to share problems with others. Therefore, creating a roadmap for trauma therapy that is specific, organic, and sustainable to the Indian setting needs to be the task of the future of psychotherapy in India. Another issue related to India is the lack of significant amount of research in the field of therapist efficacy that adds to not knowing what works and what does not. Diversity of the socio-cultural possibilities coupled with lack of adequate training for Indian setting can be a huge challenge in perceiving the client as he or she is. Now, the advent of anthroposophy is very, very recent to India. Though the Indian history, scriptures, ancient texts can take us to unfathomable depths of wisdom, creating a palatable, concrete version of applicable guidelines from this ocean of wisdom that is scattered all over India is not an easy task. When encountered with anthroposophy, the hope and light that we see towards anthroposophy becoming the catalyst to unearth our own wisdom and help it incarnate in today's times is very high. As far as psychotherapy is concerned, various aspects of anthroposophy, various aspects of anthroposophy help us reach the above mentioned goals of trauma work, adding to the efficacy as well as the spirituality of professionalism. To attain the above goals and to overcome the hindrances that are researched widely and mentioned above, a therapist needs to have a sound inner work in place. The possibility of postural mirroring, as mentioned above, is possible only in case of a therapist well grounded in holistic knowledge of the human being and well formed spiritual growth and discipline within oneself. Every psychologist yearns to reach the dream position of unconditional love, unconditional regard, and unconditional acceptance of the client. It is only with a sound knowledge of what the human being is the therapist can develop the capacity to observe the client just as he or she is and nothing else. It is only through the sound knowledge of what lies within the biography of the human being the therapist can perceive the possibilities of what this particular individual can become. It is only with the sound knowledge of the human being's growth the therapist can know as to how is this individual embedded in his or her environment to form a unique design with it. The following aspects of training in anthroposophic form of psychotherapy work deeply through the processes of diagnosis and intervention, promising a healthy separation from the client, making the postural mirroring possible and the dangers of vicarious trauma greatly reduced. The first one, as you can see on the screen in front of you, is phenomenological observation, generally taught and developed through a detailed immersion in plant study. It helps in gaining the skill of non-intrusive, unpolluted observation. The therapist gains the subconscious capacity to perceive the client distinguished from the therapist's emotional world. The second one would be the understanding of biographical transitions and transformations through the systematic study of human development within the body, soul, and spirit. This understanding illuminates how much of what is happening to the client is a very individual experience, as against something happening because one is human and is in a certain phase. For example, the questions related to the concept of trust as understood by a 5-year-old are different from that of a 15-year-old and further different from that of a 35-year-old. Thus, most experiences of human beings shift in perspective with a shift in age. Sometimes similar patterns are revisited, though from a different standpoint at different ages. Understanding the culture, language, the moral, traditional fabric of an individual is at the heart of the unique destiny of the client. The spirit chooses to be born in a certain setting to live the destiny laid out for the body, soul, spirit at the midnight hour. The history, geography, traditions, and culture is what the spirit chooses. With this choice, these aspects can influence the individual journey, and the individual journey can affect these phenomena as well. The fourth, in my view, is the understanding of the pedagogical law. The higher bodies of the therapist act upon the lower bodies of the client if change has to happen. How the therapist is able to consciously hold one's own eye and the astral body has an immediate effect on the suggestibility of the client in this very meaningful therapeutic process. The fifth, as you can see on the screen, is the ability of the therapist to hold a sense of wonder. During the unfolding of the case, walking outside of oneself and visiting the client's world with absolute ease, and also coming back with the same ease, just that now with a much wider perspective of what the trauma serves in the unique biography of the client. Therapist's own work, which would be my sixth point, therapist's own work with his or her own biography. The aspects determining the choosing of this profession, understanding the development of one's own body, soul, and spirit, comprehending one's own relationality with the world in which we exist. It is like what we say in India, Atmadnyan leads to Sarvadnyan. Within a psychotherapy training, bringing in the therapist's own person into her professional role can promise bringing out the best for the purpose of therapy. Efficacy is not about how I can be what I think I'm supposed to be. Efficacy is all about how can I be the best version of my own self. The seventh point that I would like to make, and which Steiner has repeatedly emphasized in most of his works, is about community building. Truth is relative and relational to the space, era, epoch, age that we live in. When therapy of any kind is provided with this understanding, its reach is much deeper, meaningful, and relevant. The aspect of community building is essential even for the community of therapists, so as to deal with professional hazards of isolation and also compassion fatigue. The eighth point here on my list is that of supervision. And all of us, whether following anthroposophy or not following anthroposophy, know that supervision is a very essential part and should be a very essential part of every therapist's life. Supervision that has been given great value across the therapist fraternity is also important in anthroposophy. Regular supervision helps the therapist to integrate one's role as a therapist with one's life as a human being. It also provides the contentment that comes from having a witness to your journey. And the journey is of becoming and living. Supervision from the clear understanding of transference, countertransference dynamics is very critical for a trauma therapist. The last point that I would like to make here, and which is a bit longer, is about something very unique to anthroposophy. And these are the 6 subsidiary exercises that Steiner had provided for the spiritual growth and inner work of every individual who works with other human beings. For preparing the inner self or for work with other human beings, Steiner gave something known as the six subsidiary exercises to harmonize the thinking, feeling, and willing realms. Personally, I found these exercises bringing in the quality of calibration that every therapist needs to have so that she or he can consciously witness one's own thinking, willing, and feeling processes during sessions. These six subsidiary exercises are about the control of thought that aims to gain control over, obviously, what we think, then the control of will that aims to gain control over our actions. Equanimity. This is the exercise of feeling. The goals of this particular exercise is to be aware of feelings and weaken strong feelings and strengthen weak ones so as to balance them. Positivity is another subsidiary exercise which Steiner talks about. Then comes open mindedness, which aims to be always open to newer experiences. In this exercise, feeling and willing are both combined. And the last one, which is inner harmony, is the harmony which is maintained by exercising the first five in a very conscious way. And this inner harmony exercise brings harmony between all the three, which is thinking, feeling, and willing.